Welcome to Whole Health Visions. Our program is a platform for holistic health professionals, and our goal is to educate and inform our viewers on healthier lifestyle choices. And today, we have Cheryl Wood with us. She's a homeopath. Where do you have your office?
I practice in 2 locations, West Bridgewater and East Bridgewater.
And can you tell me your story about why you got into homeopathy?
Sure. It was actually twofold. I was pregnant and reading a bunch of books about pregnancy and knowing that I was going to have 2 a.m. feedings. I prepared myself to be exhausted for about 2 to 3 months. Well, come 4 or 5 months later, I was still really exhausted. I knew something was going on. I went to my healthcare provider. We did a bunch of blood work, ran a bunch of tests. Everything came back normal. But I still felt like something was off. And my girlfriend said, "Oh, why don't you go see my homeopath?" I said, "What is a homeopath?" And I sat with her for a couple hours, and she sent me home with a remedy in a bottle. And about 3 days later, I had 85% of my energy back.
Oh, wow.
And then later on, which didn't really occur to me, to think about bringing my daughter to the homeopath, but we go to my daughter's 9-month appointment, and the pediatrician says, "Oh, she has an ear infection." I said, "Oh, that's why she was cranky the last few weeks. That's why her appetite hasn't been as big, and her sleeping was off." There was those like little beginning signs that I didn't know to pay attention to. And so went through the antibiotic route, went back a week later for the checkup, and it was gone. Then a couple of months later, she had a double ear infection, and then a few months later, another ear infection. I said, there has to be
The same ear infection.
Yeah, what is going on here? The amoxicillin felt like a Band-Aid to me. And although a lot of kids can grow out of ear infections, it just was a mask. And I was in a follow-up for myself with the homeopath, and she's like, "Oh, why didn't you think to bring her to me?" I didn't. So off I went. I brought my daughter to the homeopath. She got 1 more ear infection, and then that was it. She never got them again. So I had to learn more about this.
Sure.
This modality. I was asking a lot of questions. How is this? Why is that? And thankfully at the time a school was opening up in Cambridge. So I joined that fall, and here I am.
And that school's in Cambridge?
It was, and then it shifted to Newton Native. Newton. Yep. So.
Can you tell us what a remedy is when you say remedy?
Yep, a remedy is pretty much anything made from nature. Homeopathic remedies are minerals, plants, and things made from the milks of animals, and they do that in a humane way. And then there are other classifications of remedies, but for the most part, that's what all the remedies are.
And where can people get remedies from?
You can buy, there's online pharmacies, and there's also remedies at Good Health, health stores, as well as Whole Foods.
And how do you know that it's safe to take a remedy? Should people just go to the store and buy them, or how does that work?
So what I like to promote is people using remedies at home acutely. So for things that they normally would go to a CVS or a Walgreens, for an over-the-counter type product, you can find pretty much anything like that in a homeopathic form, a remedy. And in those health stores, there are drop-down scrolls that, say you have an acute situation as like a bee sting or a really bad bruise from a fall, or seasonal allergies, cough out of nowhere, flus, things like that, that you would normally go to a regular pharmacy for, you can also find a homeopathic product for.
So you've been using homeopathy on your own children?
Yes.
And how has that worked out for you?
It's worked out really well. I have to bring my children once a year to the doctor for their annual checkup, and other than that, we don't go unless we're ruling out a sports injury. So,
sports injuries,
potential sports injuries.
Potential sports injuries. So, and do you specialize in anything in particular? Do you work with kids? Do you work with everybody? How does that work?
I do work with everybody. I specialize with children, given I have 4 and have a lot of experience with children. I see a lot of kids on the spectrum, a lot of kids with anxiety, depression, facial type tics. I've seen gentlemen with knee problems, back problems. I've seen females with menstrual type issues.
Fertility.
Yep, fertility as well.
Seasonal allergies must be coming up.
Yes, yes. And you have to ask yourself, is it really an acute situation or is it a chronic flare-up? And a chronic flare-up is where you want to go and see a homeopath. If something either has been lasting longer than 6 months or is something that occurs every year at the same time for the last couple of years, then it's probably more likely a chronic flare-up. And that can be addressed professionally with a homeopath.
So I would imagine that you should have a homeopath that you see, and so you can call them and say, is this an acute or is this a chronic, so that you have your family homeopath. Just like you would have a chiropractor, family physician, something like that.
Absolutely.
So so have you seen anything in your family that was unusual or remarkable that with all the kids, and have you seen anything that just like stands out in your mind that you want to talk about?
A couple things. One of my children had a reaction to a vaccine, and after learning what I've learned through homeopathy and also homeoprophylaxis, we have cleared her from that situation so that she's more neurotypical and not landing on the spectrum. Another situation is one of...
Go back.
Yeah.
What do you mean by neurotypical and why would... So you said cleared. We'll start there. What do you mean you cleared her?
So she, for whatever reason, her body has a vulnerability to the particular vaccine that she received at the time. And that can lend some potential damage lifelong. And by clearing somebody, you're basically recovering them so that they don't go down that path of damage. And she's, she's fully functioning, gets A's and B's in school. Yeah, so.
And how old is she now?
17.
So, oh my gosh. And
Driving.
she was pretty young then,
Yeah,
right?
She was a little over a year.
A little over a year old.
Yeah.
Wow.
Yeah. She was a year old. So.
So, what is involved in somebody coming to a homeopath, or if somebody called you on the phone and said, I have recurrent allergies during spring, what would be next? What would happen then?
I would invite them to an initial consultation. All homeopaths would have an initial consultation. Typically, it's about 2 hours. Sometimes children can be a little less than 2 hours. They're not as layered as adults. It depends, though, on the situation. But usually your initial consultation is about 2 hours, gathering all information that we can about that person, you know, their likes, their dislikes, sleep patterns, anything to do with dreams, fears, phobias, you know, menstrual cycle, do a head to toe for physical ailments, as well as you know, how they were growing up, how their family situation is. We try to get some family history, medical information, not to say that that person's going to have those vulnerabilities, but they're there in the family, so there is that potential. And then we look at all that information and try and fit, as simple as it sounds, it can be very complex in trying to fit a remedy to that picture. Homeopathy, one of the guiding principles is like cures like, and so we try and find a remedy that exhibits those same, that exists in nature, that helps that person with those same symptoms.
So in order to make it like, it's probably not easy to do, but can you try to explain how homeopathy works? Your opinion, because I've heard a few.
In my opinion, something I've thought of more recently, any type of trauma that we experience, whether it's positive or negative, can lead our lives down these paths, as in an energetic, leaving a cellular imprint at the time of the event. And I believe that homeopathy goes in and helps to either clear that out, smooth that out, and bring more awareness to somebody's situation.
Yeah, I've seen homeopathy do some amazing things in people's lives. So,
right.
Sure.
And my another child of mine, really, she wouldn't make the charts at all with height and weight, and through homeopathy, she's now, you know, into the 30 and 40 percentiles. She's not too far behind as what she was. So.
And how old is she?
She's 14.
Wow, they're growing up.
Yeah.
So, can you? So we were looking at these earlier. Can you explain what homeoprophylaxis actually is and when you would use homeoprophylaxis?
Yep. So homeoprophylaxis stimulates the natural immune response in our bodies, and it helps to educate the immune system to respond in a natural way, which is, you know, a fever and a recovery period. So it's a 44 to 50 month program, depending on which program suits the person. But typically you start it on infants right after birth. But in my case, coming to this now, my children and I are going to go through the program as well. We just started it. So
as an adult too?
Yes. Yep. So anybody can really do. And actually, as when you started on infants, their immune system isn't fully developed until about 13 to 15 months. So with adults and older children, because that immune system has been established, you can speed the program up so that it's not as long.
So I know a lot of my friends don't vaccinate. So is this something someone could use if they were not going to vaccinate, or could you use it in a conjunction? How does it usually work?
You could use it in conjunction. It's not a replacement for vaccines, but it is an alternative, and it's used to naturally stimulate the immune system, whereas vaccines are more on the artificial level.
And I know I know that when I go to the vet, sounds funny, but I know I go to the vet. I know that they've used homeopathics on animals, and at the vet they're looking for titers. Does homeoprophylaxis produce titers?
Although, I'll read you. Can I read you?
Yeah, sure.
Because it's explained very well in this pamphlet. So HP is short for homeoprophylaxis. So HP may not necessarily stimulate the production of antibodies, as there is no physical disease agent that needs to be escorted out of the body. Rather, the general immune system, which is the ability to produce a fever and discharge, is stimulated. So with sufficient stimulation of the general immune system, antibodies may in turn be produced.
So will they get, it'll seem like they get the flu, or it'll seem like they're getting the symptoms?
It will seem like they're getting some of the, if that happens, that may not happen at all, but if it does happen, it may seem like they're getting, they have a little fever, they go through the chills.
Yeah, symptoms of the immune response.
Right. And
without the mercury and all the other stuff that's in the vaccines.
Right, which is adjuvants, antibiotics, fetal tissue.
Very good. And these books here are on homeoprophylaxis?
Yes. This one in particular, The Solution, which is written by Kate Birch and Cilla Walcott.
So someone could buy this online and just read it and see if it's something they're interested in doing?
Amazon, yep.
On Amazon.
Mm-hmm.
And this just explains all about what homeoprophylaxis is?
Yes. Yep. It goes into a lot of detail. And in the process too, the remedies are administered by the parents. So the parents will get a kit. They're working with a HP supervisor, and once a month, the child or the infant or the child is taking the laid out schedule of remedies.
Remedies.
Mm-hmm.
So, I mean, this is very interesting. And so that's not, but that's very interesting, but it's not what homeopathy is all about either.
Correct.
So, homeopathy, would you say that homeopathy is, you would have a homeopath instead of a medical doctor?
Some do. I don't know if I would, because I really feel there's a place for the medical community as well. We need to be able to run some tests and, either rule things out or, I would hope most people know things are off on their body. Sometimes they don't know, and when tests are run, then things come up as well. So, but I think there's a place for the medical community, and it would be really great if we could really mesh that together.
Now, how does if you had a homeopath, then you would need some guidance in other areas of your life too. So would you, if I was looking for a homeopath, would I expect that my homeopath would do other things besides just homeopathic remedies? Would she coach? Would she help me with my health as far as diet and exercise, or is that is that something that you would refer somebody out to do?
It depends on the homeopath. Some do have other specialties along with the homeopathy. Some are psychologists that have brought homeopathy into their practice. Some are nutritionists that have brought homeopathy into their practice.
Nurses, I know some
nurses, exactly,
yeah,
yep.
Big with that.
Yep. So it would depend, and a well-trained homeopath would, if something is not of their specialty, would know to refer, or should know to refer out.
So I would imagine that somebody who's I know a little bit about homeopathic that goes back a long ways, right? So I think it's probably changed, the way people approach things has probably changed since the original Hahnemann discovery of how it works. I know that people are very unhealthy right now, so it can't just be like you give someone a remedy and it's done. It has to be a program of health, of getting healthier, right?
Exactly. Hahnemann believed, the founder of homeopathy, that it's not just a remedy. It's really looking at all aspects of your life and making changes where necessary, whether it's food or smoking, where you live, exercising, making sure you have some type of exercise daily.
Stress level maybe.
Right.
Right.
Exactly.
And history of events in your life that, like you were saying earlier. Like someone was asking me earlier, or mentioning to me earlier, that they have a family member that had a brain aneurysm. And when they fixed the brain aneurysm, she was left without speech. And I was thinking maybe homeopathy would be a good approach to try and bring that speech back. Do you think that would be something someone could use for something like that, even though it's physical and physiological, I mean?
It's definitely worth a try. I don't know if it would clear that or not, but definitely worth a shot. Anything
else you want to add? There's a lot of history with you and homeopathy. You've been practicing homeopathy since when?
Formally since 2013, so the last 6 years.
As a practitioner?
As a practitioner.
And is that all you do, is homeopathy? Do you do any other things with people?
I also use cell salts, which are homeopathically prepared. And I have dabbled with some gemotherapy as well.
And what's that? What's gemotherapy?
Gemotherapy is a liquid supplement made from when the buds of plants are just coming out. And there's a lot of nutrient information and support in that bud in the very beginning.
Is that stem cell? Is that what I heard? Is that the stem cells from the plants?
Probably. I don't know. I don't know for sure. Yep.
And what do you use that for? Would you use it along with homeopathy? And
a lot of homeopaths will use that in preparing the body for the remedy, for the homeopathic remedy. So, if somebody's organs aren't cleaning out correctly or working properly, based on their intake, you can tell if someone's kidney's overworking or someone's liver's overworking. So the gemotherapy is used to help prime the body, I guess, is what you could say, and make sure that the elimination process is working well. And then adding the homeopathy remedy to that makes things speed up faster, the healing process.
Is it like, would you use it at the same time, or would you would use it first and then you would stop using the gemotherapy and go into homeopathy?
You would use it first, but then also you can interchange, so every 3 weeks you're using the homeopathic remedy, gemotherapy, and then possibly cell salts as well. Anything to help support the body.
And does homeopathy cure a person?
Technically and ethically, we're not allowed to say cure. Only a medical doctor.
Because I understand that nothing cures except your own body. You're healing yourself. All these methodologies are all supportive, except for maybe pharmaceuticals, which kind of push and like force. But there's a lot of like herbals and a lot of homeopathic and, like you said, gemotherapy that come in and sort of support your system while encouraging it to heal itself instead of. That's why a little trick question there.
Well, and then there's also yoga. Acupuncture,
Meditation,
meditation, shiatsu, massage therapy. All these modalities help to support the body and help to ignite the body's own healing abilities. And it depends really what works for some people. Some's going to be massage, some's going to be acupuncture. It could be a combination of all.
Yeah, I know it's probably people can try different things, and some things are going to resonate with them, and so they'll stick with that. Well, I actually have a whole bunch of other questions.
Sure, bring it.
Bring it on. So do you find that that it takes a long time? Is it like a magic pill? When somebody comes to you, can they expect to like spend a month talking to you and working with you, or is it more of a long-term thing, especially if it's a chronic? Is it what would I expect if I came to you?
It would depend on the ailment. In some cases, it would depend on the person. You're building a relationship of trust. In some cases, I had a gentleman that he was a trucker, and he had a really bad accident, and in his 20s. And a lot of times people will say, oh, well, I'll just deal with it, but it pops up later on in life. And but he had daily migraines for years, 26 years. And within a few weeks, he was not having daily migraines. He would still have a couple here and there, but it was not daily. And what a stress relief,
right.
On the body, on himself, on his daily life, not reaching to pop, ibuprofen,
Right.
So it is a management of the case. It's finding out what the best potency is for somebody, the frequency of taking that remedy. So there's some management in it. It's recommended to have a couple of follow-ups so that, we make sure we have the right remedy, because we can sometimes not get the bullseye, we get around the bullseye.
Mm-hmm.
So, and then with clearing some of the layers that people have, particularly adults, we're more layered, we have more life events, traumas, and et cetera.
Illnesses, medications we've been on, things like that.
Exactly, right. All these environmental triggers.
Now, how about, I'm a veteran, how about PTSD? Does it help with PTSD?
Yes, it helps a lot.
Because you can have PTSD from military, you can have PTSD from when you were a child and you were beaten, you can have PTSD from school, so there's that's what you mean by layers. Yes, there's like so many things that happen in our lives.
Right. I mean, we look for the patterns and what the typical response is for somebody, but usually, you go right to what was the initial causing event that took place, and
back off from there.
Yeah.
So it is a process for sure.
Yeah, that's where the complexity lies, in trying to.
Patience too.
Right.
Very good. Is there a way that our viewers can get a hold of you?
Sure. www.cherylwoodhomeopathy.com. That's CherylWoodhomeopathy.com.
And do you have a phone number?
Yes, 508-331-3739.
Well, thank you so much for coming. I
Thank
hope that
you
you
for
get to come
having me.
back on again. We'd love to have you talk a little bit more in depth about what you
Absolutely.
do. Thank you for watching Whole Health Visions. If you have a story you want to tell, or you want to just be a guest on the show, please email me at wholehealthvisions@gmail.com. I'm Heidi Martin, and as Mahatma Gandhi once said, you must be the change you wish to see in the world. Thank you for watching.
This program was made possible by your Franklin friends and neighbors, good folks just like you. Thanks for supporting Franklin TV. And thanks for watching.